Dr. Eli, Clinical Director here at VORA Dentistry.
And I'm Cynthia, Patient Care Coordinator here at VORA Dentistry as well. Your first contact through Facebook, Instagram, text message, or even a free virtual consultation to start your dental journey.
And today we're going to talk about All on X. We're going to go over a case. We're going to go over how you get from your home to the actual clinic, get the procedure done, and go back home. So if you're ready to start this journey, let's go.
Today we're going to talk about the All on X, and this case is about Adrian. He flew all the way from Wisconsin. I helped coordinate his flight, transportation, and hotel.
So Adrian came to visit us because he wanted an All on X treatment. He had been to previous dentists in the US before that have told him that his teeth needed to go. Now, it's very important for me and for the patient to fully understand what an All on X treatment is all about, because there's no going back. If we can save his teeth and we know that they're gonna last more than 7 to 10 years, that's our first option always. But Adrian, he had previous consultations in the US and his teeth needed to go out. It is very important for me in the initial consultation to get to know the patient, what his expectations are and what he wants to get done. For us, it's also very important to have his main concerns addressed and what he can actually expect.
Speaking to Adrian while he was here, I understood what he really wanted was to smile again. And I think that we took a really good care of that.
So the first step that we have to do in any consultation is take a look at his mouth. We're gonna take studio photos of his face and of his smile so we can start the initial assessment of what we want. This is Adrian, and this is the initial photo that we start with. We ask him to relax and to smile because we want to make sure that we get his eyes, his nose, his forehead, and his smile so we can start an analysis and assessment of what his smile looks like. So let's go over his smile. I did a little close-up so you can see the eyes, the nose, and the mouth. As we can tell right from the start, there's something off with the smile. Not just the teeth that are broken, but we can see that they're a little bit tilted. The first thing that we take analysis is the midline. With the midline, we can tell that his nose is tilted one way. We also want to make sure that we get the eyes so we can have a reference of where the things should be. And this is where it gets interesting. The lips, they're in the correct position, but we can see from the teeth that they're tilted to one side. So his smile is pretty much tilted to one side. So that lets us to know and lets us to believe that he has a skeletal problem. We can also see the lips, which is also very important to point out to the patients that we have a curvature here and then it goes down here as well. That's why when he smiles, he shows more gum over here, less teeth, and we want to correct all this. And we can correct all this through All on X. All on X is not just replacing teeth. We also want to make sure that the gum, the bone, and everything is even. We can also assess from this picture here that he's only making contact in this area over here. We also want to correct that. That's going to let us to believe that the best solution for him is All on X.
This is something that the patients ask commonly. What do you guys do to correct my smile? It's not only just fixing the teeth, but also assessing these types of studies so you guys know you're going to have an excellent result at the end.
Now we take a closer look at his smile. From what we can see that his teeth, they're starting to break apart. There's cavities everywhere. We call this terminal dentition, where we cannot really replace teeth knowing that they're gonna last for a very long time. We can also assess that we have more bone over here and less bone over here. The next picture that we're gonna assess is a full retracted mouth picture. Now we can fully see cavities starting to develop underneath of the teeth, broken teeth, and the midline is way off. We can also assess over here that only these teeth are connecting, are making contact. So we want to make sure that when we plan for the implants and when we plan where the teeth want to be, we want to make sure that we correct all this part.
Guys, I want to make emphasis on what Dr. Eli is saying. It's not just about making something really pretty, it's about bringing function to your smile, to your bite, and something that's going to last for a very long time.
Now that we made the facial analysis, the smile analysis, and the teeth analysis, and we are sure that the teeth need to go, we're going to take a look at the CT scan. To make everything easier for the YouTube video and for the patients to understand, we're going to look at a panoramic X-ray. On the panoramic X-ray, we can see the same thing that we saw in the photos of just these teeth making contact. Slightly over here, but the rest of the teeth are out of context. We can also see decay on most of his teeth, and that's why we decide to do a terminal dentition. When we look at a panoramic X-ray or a CT scan, there's several things that you should know as a patient what we're looking for. Two of the most important things are the sinuses, which we drew here in green. This is going to determine where we can place the implants, and on the bottom, the nerve that runs here on the bottom. These nerves, this nerve and this sinus are going to be my landmarks of where I can actually place the implants. It's also very important to understand the difference between all-on-4 or all-on-6, because it's a common question from patients: do I need 4? Do I need 6?
When you guys ask us about having an all-on-4 or having all-on-X, yes, you can go ahead and have assessment done, but the best thing is to always have your CT scan so he can go ahead and assess what is best for you. Not all patients are candidates for the all-on-4. We need to make sure that the correct treatment is planned for you.
Considering the anatomical landmarks that are going to mark where our implants could do, if we decide to do an all-on-4, which is a question that Adrian and his wife had, how many teeth can I actually replace with 4 implants? How many teeth are actually going to be showing to his smile? I don't determine that. The way you smile is going to determine how many teeth you're actually going to show. If you see on this X-ray, if we just place 4 implants on the top, I have to angle these 2 implants so we can avoid the sinus. We have to angle the lower implants as well so we can avoid the nerve. If we just decide to do these 4 implants, we can only truly cover all the way up to this teeth. This was a question for them. How many teeth am I actually going to get if I only do 4 implants? So considering his smile, if Adrian only wanted to do 4 implants, we would only replace up to this tooth here and up to this tooth here. But he has a wide smile. He shows a lot of teeth. He shows all the way to the first molar on this side and all the way to the first molar on this side. Lower, same thing. He shows all the way up to the molar. So if we just decide to do 4, the arches have to be shorter because it's a lot of stress. That's why we want 6 implants so we can have more teeth and more stability as well.
We have to take in consideration as well that the patient is at least 6 feet tall. So that's something very important that you guys need to know. Not that this is why we plan all the cases for you guys, because not everybody is the same. So by us taking pictures and doing a specific treatment plan for you, is what we based it on is your height, your weight, and the distribution that Dr. Eli has to do in order to place the correct implants.
Adrian's case, if we decide to place the extra implants, 6 on the top and 6 on the bottom, we can for sure get all the way up to the first premolars and all the way to the molars. So we're not going to have any situation of having less teeth or having to compromise with a longer cantilever. Ideally, this is always the correct setup. The only thing that's going to stop me from placing those extra implants is that if there's absolutely no bone here in the back, or it's impossible to place a pterygoid implant or a zygomatic implant.
Our all-on-X package includes zygomatic implants and pterygoids. You're gonna see that it's a flat fee, no add-ons, no surprises.
And this is what I really want to make a big emphasis. On our all-on-X packages, we're going to give you peace of mind. There's no extra add-ons, no nothing. Bone grafts are covered. If you need extra implants, they're there. If you need a zygomatic implant, we can place it. If you need a pterygoid implant, we can place it. If you need an extra implant, we're going to place it as well. We want to give that patient that peace of mind of knowing that this is what you're going to get and this is what you're paying, that there's no surprises.
We understand that you're coming from far away and that coming to a dental, it could be a little bit scary for some of you guys. So while we go ahead and have this treatment done, you're gonna go ahead and be asleep and you're not gonna remember basically any of this. And we understand, we wanna go ahead and, like he said, give you that peace of mind.
And this is the panoramic X-ray after the surgery. As you can see, we were able to place the 6 implants on the bottom and we were able to place the 6 implants on the top. We were able to place a pterygoid implant and a zygomatic implant. This is gonna give us freedom of having actual 12 teeth on the top and 12 teeth on the bottom with no cantilevers. This is an actual 3D image of the before we actually did the surgery. You can actually see some of the broken teeth, and now we're gonna see the after CT scan. We're gonna see the zygomatic implants, the 4 implants on the top, the 6 implants on the bottom, and the pterygoid implant. This is the after picture 28 hours after the surgery. What we like to do the consultation the first day. You get to sleep and rest the first day. The second day, we do the surgery under IV sedation. We do the intraoral scanning. After the surgery is done, we do another scan. you go back to your hotel, you rest. The next morning, we do a quick test, a 3D printed test to make sure that our records are taken correctly, that you're biting perfectly and that the teeth look good. And that same day in the afternoon, we deliver this. As you can see right from the start, a little swelling, but it's good. But we can see that the teeth look good. He looks happy, we're happy with the results.
Guys, I just want to go ahead and remind you that just like Adrian, these teeth are fixed to his implants, okay? There's no more removing, no polygrip, nothing like that.
This is the facial analysis after the surgery. We're gonna do the same procedure. We're gonna see that the midline is according to his teeth. We're gonna do the eyes as well. We're gonna do the lips. And most important here, we're gonna do the incisal line. And we can see here that everything is perpendicular, everything looks good. And we also fixed another thing. The lips are also looking great. So this is not just about teeth, this is not just about gum, this is not just about bone, this is also about your face, muscles, and your TMJ as well. We were able to correct from him only chewing on one side to him actually being able to contact on both sides.
When the patients ask us why we have one whole day just for planning, this is why. We like to go ahead and give you harmony, not only on your face and your teeth, but give you that peace of mind that everything will be okay at the end.
And this is a picture of his smile 28 hours after the surgery. As you can see here, this is not canted, this is not slanted. We were also able to correct the black holes that he has in the back. Now when he smiles, he's only gonna show teeth, both on the top and the bottom. And as you can see, all of his teeth are making the right amount of contact.
So this is one of the end results for Adrian. Obviously he has to come back to get his finals, but when have you seen somebody smile like that after a surgery? Okay, so 4 days made a difference for him in recovering his confidence, his smile, and his life back.
This is the before and after of his smile. You can see the difference right off the bat. If we see the before, we see that only these teeth are making contact. If we see the after, we can see all the teeth making contact. It is night and day in 28 hours. This is why we decide to plan. It is very important for us to get the first day, take pictures, take scans, plan out the surgery, and then the next day we actually do the surgery. We don't want to rush, but we actually want to plan because we want to make sure that this investment that you make lasts the longest. I personally want to thank Gretchen and Adrian for trusting us with this procedure. I know this is not an easy decision, but I want to thank them from the bottom of my heart for making it here to VORA Dentistry. And if you, like Adrian, wants to change your smile, wants to start eating again, make sure to give us a call, send us a message, or leave a comment here below and subscribe to our channel.
If you're ready to start saving up to 70% on your dental care and you're looking for results just like this, go ahead and look us up. We're on Facebook, Instagram, and we also have a personal number that you can go ahead and find. Remember to subscribe and like on the comments.
Thank you for taking the time to watch this video. I'm Dr. Eli, Clinical Director here at VORA Dentistry. This is Cynthia, Patient Coordinator. Thank you and see you in the next video.